Hello, this is your slideshow on male reproductive anatomy. So, we're just going to go through the reproductive organs and their functions. And before we start, I want to make a couple things clear. First of all, we only use proper terminology when we discuss anatomy or we discuss behaviors. So, this is a great chance for you to learn those proper terms if you don't already know them. And secondly, it's important just to understand how these systems work. There might be some questions answered. You might already know all of this. I know that it's a repeat from your biology lessons, but hopefully it's a great way just to start talking about this stuff. And as we move forward, you can have any questions answered by looking back on this slideshow maybe. So, male reproductive anatomy. So, this is the big picture of the male reproductive anatomy. Okay, what we're going to do is we're going to start here where the sperm are produced. Okay, and then we're going to follow the journey of the sperm. It actually goes up there, down here, and then out. So, that's how we're going to do it. Let's start. First thing we're going to talk about are the testicles. There are obviously two of them, and they are in the scrotum, which is here. And the testicles are responsible for two really important things. They produce sperm and they produce testosterone. So the male hormone, which is testosterone, is produced there all the time. And they are also producing sperm all the time. Sperm are produced every single day, okay? There's 100 million sperm produced every day. That's a lot of production. So, excuse me, that extra sperm, if you will, the sperm that don't end up leaving the body and looking to fertilize an egg, they just get broken down and reabsorbed into the tissues. So, it's really important that the sperm always be fresh and available. We have to remember that the main purpose of the reproductive system is to reproduce. So as we discuss all these different parts and their functions, it's important to remember the big picture, which is to make a baby. So why are these sperm produced every single day? So that the strongest, most viable sperm are available to fertilize an egg and make a healthy baby. That's why that's the case. And again, testosterone is the male sex hormone. Okay? So this is just a picture. There's going to be a variety of different images, medical anatomy type images. So just take a look at that. Sorry for that noise. I need to turn the sound off on my cell phone, obviously. All right, let's go move on. From the testicle, the sperm or the testicles themselves are located in a sac of skin, which you can see right here. This is obviously a side version where they've taken the skin off for the purposes of the image. And that's where the testicles are held. The reason why they are held outside of the body is to regulate the temperature. Why is temperature important? Because the best temperature for sperm production is a few degrees cooler than internal body temperature. So the testicles are located in a place where they can remain cooler. So the scrotum is responsible for doing everything it can to keep that temperature consistent. For example, if the man is in a bath of hot water, okay, so there's heat, the scrotum will relax and allow the testicles to move away from the body. If it's exposed to cold, the scrotum will pull the testicles up closer to the body so that they can stay warmer because they're being exposed to cold. So that's the purpose of the scrotum, okay? And it's all about temperatures so that optimum sperm production can happen. All right. So then there's this little thing that sits on top of the testicle, one on each of the two testicles. It's like a little comma, and it sits on the back. It's like riding piggyback. And what it does is it's the place that the sperm go after they're produced, and they mature there. So the sperm spend 2 to 6 weeks in there learning how to be productive, effective sperm, maturing, getting all of the matter and all of the things they need to fertilize an egg. Okay. And I like to call it Epididymis University because it helps you remember that this is the place where the sperm go to learn how to be quality, productive sperm. Everything they need to know about their mission in life happens at the epididymis. Okay? Now, let's say a bunch of sperm go into the epididymis, they hang out there, they learn all they need to learn, but they never exit the body. Again, the quote-unquote extra sperm, they just break down and go back into the tissue. There's no buildup that's uncomfortable. There's no requirement to release sperm or ejaculate on a regular basis because of too many sperm. They just break down and they just go back into the tissues. Okay? So in this diagram, you can pretty clearly see the epididymis here as it sits on the back of the testicle, all of which is still housed in the scrotum. All right. Then from there, the sperm, now we're talking about where they're traveling. So now the sperm are going to travel, okay? Sperm have little tails and they swim. And if you were looking at me, you could see me making a little motion about swimming. They swim and they go into these long, thin cords. These thin cords start at the epididymis and go all the way around through the abdomen. And at the prostate gland, they become one tube and they create then the urethra so they can exit the body. Okay? So it's the passageway for sperm, and some sperm are stored there as well. In order to understand how the vas deferens works, I think understanding what a vasectomy does can be helpful. Obviously, it's called a vasectomy because it's a part of what happens with the vas deferens, okay? So let's take a look at what happens with a vasectomy. So this is the male reproductive system. Here you've got the testicles, right? And we just learned that this is the epididymis. From the epididymis, you have these long, thin cords. And take a look at their journey. They go up here, around the bladder, behind the bladder, down into the prostate. Under the prostate, then they connect and create one tube, which is the urethra, and then they go out the body. So, vasectomy is a procedure that a man has whereafter he is no longer able to have children. So the vasectomy makes it so that his sperm will no longer be able to go into a female and fertilize an egg. So here's how it works. Please look at the anatomy carefully as we talk about this. So a doctor will go in and make a small incision in the scrotum, just a small one. These are like tiny, tiny little tubes. They're not like the size of a pen or a pencil. They're more like the size of a smaller than a small, thin spaghetti noodle. Really little. Sperm are tiny. You can't see sperm, by the way. You're not going to be able to look and see sperm. So anyway, the doctor will make an incision in the scrotum and they'll use a little tool and they'll just pull out this vas deferens and then they just snip it. And with current medicine, when they snip it, they usually just glue the ends of it, and then put them back in. Then they do the same thing on the other side. Okay? So now, why does that make it so this man can no longer have a baby? Here's why. The road is out. Okay? The road, the tube that the sperm need to travel, they can't get past this point. Okay? So are sperm still produced? Absolutely. These testicles do not know that the road is out. They will still produce sperm. They will produce sperm, and the sperm will still go into the epididymis, and the sperm still think they're going to leave the body, but they never do. They get to here, they just break down, they go away. Okay? So, what does that do with regard to sexual function? Will this man still have an erection? Will this man still ejaculate? In other words, will semen, the liquid that usually has sperm in it, will that still come out when a man ejaculates or comes? The answer is yes. All of those functions still work. The testicles are still producing testosterone, which is what makes this whole system do its work. Okay? Nobody knows there's no sperm. The semen, which is the liquid, is produced by this seminal vesicle and the prostate gland, both of which are beyond this point where the sperm are blocked. So everything happens normally. The man will still have an erection, still have sexual arousal, all of those things will still happen. When climax comes, he will still ejaculate. The difference, there is no sperm in the semen. So semen is the liquid that the sperm are in. Okay? And no, you can't just look at semen and see sperm swimming in there. They're way, 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 way too small. Okay? So there will still be semen. The difference, there are no sperm in that semen. And that's what a vasectomy does. All right, let's move on. The prostate gland is one gland, and it sits underneath the bladder, and it surrounds the urethra. Okay, and that location is something that is important to understand because you've probably heard about men having enlarged prostate glands. And you've probably seen advertisements on TV that show a man waking up in the middle of the night because he feels he needs to urinate, gets to the restroom, and nothing happens. That's a part of the prostate gland. As a man gets older, the prostate gland enlarges. That enlargement can put pressure on the bladder. Remember, it lies beneath the bladder. And that pressure that the prostate gland puts on the bladder can make it feel like a person needs to urinate. Okay? But really, there's no urine in the bladder. It's just the prostate gland making the person feel that way. This is not something that's typically going to happen to a 15, 16-year-old kid. We are talking older men, okay, in their 60s and 70s, for whom this is usually a problem, okay? Don't worry about your prostate gland enlarging at your age, but it is something that is a concern, and it's something that you hear about because there's all sorts of medications out there to help it. So just for an awareness perspective, that's where the prostate does. From a reproductive function, the prostate gland secretes a fluid that's part of the semen. Okay, so it creates part of the semen. And again, it commonly enlarges as men age. It's also a common site for cancer. The good news is most men are tested regularly when they have annual physical examinations, and they can in most cases, catch this enlargement at an early stage so that the man can have it treated early, and it isn't become a serious or a potentially life-threatening problem. So here's another picture. If you take a look at where the prostate gland is, you see it here, right below this big thing right here called the bladder. Bladder is bigger than the prostate, okay? The prostate's probably the size of a dice. I was gonna say acorn, but you might be more familiar with the size of a dice, or a die, excuse me. All right, let's move on from the prostate gland to something called the seminal vesicle. Now, this is a different view. This is a view from the back. So the penis is on this side of the bladder. This would be if you're looking right through the person's lower back. Excuse me, you get a better idea of where the prostate gland is. You see, this is where the vas deferens comes in. These are the vas deferens. Okay. Seminal vesicle, which we'll talk about in a second, is right here. There are two seminal vesicles. And I always say they look a little bit like bunny ears sticking up. There's two of them. By the way, this tube right here, that is called the ureter, and it's the tube that connects the kidney to the bladder. Okay? So the fluid that comes from the kidney after it's filtered, that will go into the bladder before urination, that's called the ureter, and that's what this tube is right here. So the seminal vesicle, they're these glands, and they also provide the liquid of semen. Most of the fluid that makes up semen is produced by the seminal vesicles. Also, keep in mind, most of these organs don't do a lot of work until sexual arousal. Okay? It's during, they produce the fluids and such, but it's during sexual arousal that they do their real work, when they put together the magic potion that is semen, that has the properties that the sperm need to stay alive and stay strong. Remember the journey. The sperm are going to leave the man's body, go into the woman's body, and they need to get to the egg. It only takes one sperm. So by having millions and millions of sperm, when the man ejaculates in the semen, the chances are pretty good that a really strong, fit, fabulous sperm is going to be the one that fertilizes that egg. All right. This fluid that's produced by the seminal vesicles has two properties. It's alkaline, and it's alkaline because it's going to go through the urethra of the man and through the vagina of the female, and it might be an acidic environment. Okay, so this alkaline will neutralize that acidity, and it makes it safe for the sperm. The fructose, you've probably heard that before. Okay, it's a sugary substance. That's what the sperm eat. They are nourished and fed, and they get their energy from this fructose environment. So it's very important. All right, let's move on to the urethra. So after the vas deferens come together back here behind the prostate, they create this one tube that goes through the penis, and it's the exit pathway. It has two functions. The first function is for semen. Okay, so during sexual arousal, semen leaves the body through the urethra. During day-to-day life, it is also the passageway through which urine leaves the body. The urine leaves the body through the urethra, the same place that the semen does. Now, during sexual arousal, all sorts of stuff is happening here, okay? There is a system of events that happens collaboratively in the male reproductive system. That's kind of amazing. One of the things that happens is there is basically a shutoff valve that closes off the bladder during sexual arousal so that there's no urination or the man can't urinate. It's like, hey, wait a minute. We're using the urethra for semen in a minute. Just hold off. Okay? So that's what happens. That's why that isn't a thing. Okay? So the urine and the semen won't be in there at the same time. All right. Don't worry about these numbers, by the way. That's for some diagrams that we are not going to use. All right. So the penis. The penis is the male organ for sexual reproduction. It is the part of the man that goes into the female to deliver the sperm to the female reproductive system so that it can fertilize the egg and make a baby. There's a couple different parts of the penis, and we will look at the diagram right now. Let's get this up here. I'm sorry if this diagram makes you uncomfortable. It is a medical diagram, okay? I want to say one other thing. This is not a photograph of anyone's penis. If a person's penis does not look like this, that's okay. Penises look different with every human being that has one, okay? Some are longer, some are shorter. Some extend beyond the scrotum. Some scrotums hang lower on the right rather than the left. It's totally individual, okay? So let's talk about these two different pictures. This is a penis that still has a foreskin on it, okay? And we'll talk about removal of that in a second. This is a penis that does not have a foreskin on it, okay? The penis in this state is called flaccid. It's kind of a dumb word, but flaccid or soft. So this penis is not erect or hard. It is just a soft penis. It cannot be inserted into the vagina when it's soft. All right. So this tip of the penis is called the glans, Glans, and it is very sensitive, and it is covered with this loose skin called foreskin. Okay? Sometimes after birth, that foreskin is removed, and that procedure is called a circumcision. Now, in most cases, there's no medical reason for a male to be circumcised. It's something that is a family decision. A lot of times families base it on their family history. Sometimes it's a religious decision based on faith or culture. So there's a lot of different reasons why men get circumcised, but it's not medically necessary. Okay? When the penis becomes erect, this foreskin will pull back. Okay? So the tip of the penis will become exposed during an erection. All right? When the penis becomes erect, it's because there are spongy tissues in the penis that get filled with blood. Okay, during arousal, like I said, all these different things go into place. All these different procedures and things happen. And one of the things that happens is the penis becomes erect, so that can deliver the semen and the sperm into the female. And that erection happens because these spongy areas are filled with blood. Also important to remember about erections. They don't have to result in an ejaculation, and they are an involuntary response, okay? Little 2-year-old boys can have erections, and they certainly have nothing to do with sexual arousal, Okay? It's when a man becomes older, a young man becomes older, that sexual arousal plays a big part, but erections can happen without any arousal whatsoever. Okay? All right, so ejaculation. This is when the semen come out of the penis. Sometimes it's called an orgasm or coming, and it is climax of the male sexual arousal. Remember, semen is the fluid that contains sperm. Sperm are the little guys that swim in the semen that fertilize the egg. They are two different things. Semen can exist without sperm. There can be semen without sperm in it, like we talked about with the vasectomy. Sperm can't be present without semen. All right. This occurs, ejaculation occurs when the muscles at the male reproductive system at the base of the bladder contract, and that contraction causes the semen to be expelled, okay, or it leaves the penis. There are approximately 400 million sperm in there, in that 2 tablespoons or so of semen, okay? It's not like gallons of liquid come out. It's just a couple tablespoons, okay? And in that, there can be 400 million sperm. And remember, it only takes one to fertilize an egg. So if you're going to mess around with your reproductive system, and by mess around, I mean have sex, you have to remember that it is all about having a baby. It will do everything it can to have a baby. Okay? So that's why we need to be educated about the results of our behaviors. If we want not to have a baby and we want to use our reproductive system, we have to learn how to be smarter than our reproductive system. And that's part of what we're learning how to do. All right, so flaccid is that goofy word I talked about before, okay? You don't have to know what corpus cavernosum is. That's just what they call those spongy tissues in the penis, okay? And when the penis becomes erect, they fill with blood, and that's when the penis becomes hard. And it needs to be this way in order to go into the vagina. All right, so this is a YouTube video that we're going to watch now. Hopefully you'll be able to hear it. And
the primary role of the male reproductive system is to produce and deliver sperm to fertilize an egg in the female. These sperm are produced outside of the body cavity by the testicles, which are located in the scrotum. The scrotum protects and supports the male reproductive organs that are located outside of the body cavity. These include the testicles, epididymis, and vas deferens. The testicles produce about 300 million sperm each day. However, this is possible only if the temperature of the testicle is 93.2 degrees Fahrenheit. The scrotum maintains this temperature by adjusting how closely it holds the testicles to the body. The interior of each testicle consists of multiple lobules, containing 2 or 3 seminiferous tubules. It is within these tubules that sperm formation begins. The sperm moves out of the tubules into the epididymis, and then into the vas deferens. The vas deferens carry the sperm upward into the body cavity. After the sperm leaves the vas deferens through the ejaculatory ducts, they pass the openings of the seminal vesicles. The seminal vesicles, which are located near the base of the ejaculatory ducts, secrete a thick yellow substance to nourish the sperm. This secretion forms 60% of the volume of the semen. Semen is the sperm-containing fluid that is ejaculated at the climax of male sexual excitement. From here, the semen travels into the 8-inch-long urethra, which transports both urine and semen, but not at the same time. At first, the urethra is surrounded by the prostate gland, and then it is surrounded and protected externally by the penis that is relaxed except during sexual excitement. During sexual excitement, the penis stiffens and enlarges so it can deliver the sperm into the female vagina. During the expelling of the semen, which is known as ejaculation, the prostate gland secretes a thick alkaline fluid that increases the ability of the sperm to move in the semen. Located just below the prostate gland are the bulbourethral glands. These glands open into the urethra, and, during sexual arousal, they secrete the pre-ejaculate fluid that flushes out any residual urine from the urethra. It also lubricates the urethra to help the sperm pass through. When the male ejaculates into the vagina of the female, the sperm must travel upward through the uterus to fertilize the egg in the fallopian tube.
All right, so that's a review of our male reproductive system. And I believe this is another animation of the pathway of the sperm. All right, so that's the end of our discussion about male reproductive anatomy. I will have this video linked and a couple other resources for you. Female reproductive anatomy video will be tomorrow. So have a great day.